Thank you so much and welcome everyone for today's webinar organized by Breast Cancer Hub. And today's webinar, basically, I'm doing it in honor of Dr. Bhaskar Bora because we met over the Zoom and he was very interested that we host a webinar, especially for his own network of friends and in the UK and in India. And it will be recorded so it can be shared within the forum too. So a brief introduction of Dr. Bhaskar Bora. Dr. Bhaskar has been a doctor in the National Health Services since 2004 till 2019 when he sustained a severe spinal cord injury followed by cancer of his thyroid, which left him incapable to practice medicine. He is now a campaigner for cancer awareness and disability and an author and motivational speaker. He recently published his bestseller book, The Second Chance in Life. Welcome, Dr. Bhaskar, to our Breast Cancer Hub family. And Dr. Bhaskar will be moderating the session. And at the end, he'll also speak about his journey in a nutshell. Thank you, Dr. Bhaskar. Over to you.
Thank you very much, Lopa. It's really an honor to be talking to you today and to all our audience. I hope more people will be joining soon. I have been hearing a lot about Breast Cancer Hub, and it's really commendable all the work that you are doing. And I hope that through the series of webinars, with the beginning today, we will be able to bring in more awareness about the early detection of cancer. And I'm sure many people know about you, but I would want to just do a brief introduction about yourself as well, so that all our audience, especially from my network, know about you. So Dr. Lopamudra Das Roy is a distinguished cancer scientist, research professor who actually resigned from a rewarding career in 2017 to create this breast cancer hub as a full-time pro bono humanitarian service, saving lives globally by making impactful, sustainable changes, working at the grassroots level, bridging the gap between the developed and the developing countries. So it's really commendable, all the work that she is doing. Her research work is attributed with high impact factor publications, inventions, citations, press releases, and global recognition of the American Association of Cancer Research. She is also the recipient of many global awards, notably the 100 Global Women in Leadership, one of the 5 inspiring women around the world leading the fight against breast cancer, global cancer awareness, and many more. So it is once again wonderful talking to you. So let us start the session. And I hope we will get some more questions from the audience, which we will take towards the end of it. So I would start off, Lopa, with the first question. What do you define as the early diagnosis? And what is the advantage in terms of the treatment and the survival rate?
Yeah, thank you so much, Dr. Bhaskar. So it's a great question, and I'll probably do a PowerPoint presentation, to explain the process about early diagnosis and why it's important. But I would just like to give a brief about like the campaign that we have been doing since 2017, the inception of Breast Cancer Hub, about the awareness, because it's so important that the reason for starting Breast Cancer Hub itself was basically going back to my own story when I was 12-year old. Like, one of my friend's mom in Guwahati in Assam passed away. And when I went for the funeral, even to utter the word cancer, it was a big taboo. So I kept asking, like, cancer where? And after a lot of resistance, someone said it's breast cancer, but with a lot of hush feeling that I'm not supposed to talk about it. And this was the impact that stayed within me, because I come from a family of physicians. My father, late Dr. Chandrasekhar Das, he was a pediatrician. My grandfather was a physician. We always spoke about in the household about, about all the health problems. My dad would always advocate about breast milk. So this was something very shocking for me. And then over the years, I realized how women do not present early in the developing world, especially because of the ignorance and also inaccessibility to healthcare facilities, proper treatment guidance. All of these concerns was the reason why the breast cancer hub was started. Now, when I talk about your question with early diagnosis, why it's important, I also would like to just give a brief, about you all can see my slide, right? So basically, I always, the reason for early diagnosis is the main thing is that we do not want to lose anyone to breast cancer or any other types of cancers, right? So that is the main reason. Now, why? Because I always start with a tribute, and we have from our breast cancer hub family, we have advocates, who when they reached out to us, they were already late detected. For example, here Lotika Das, and she such young kids, right? I mean, and it's not about the rural sectors alone, all educated women, but still we lost them because when we tried to find out what was the reason for both the women over here from both the cities in India, it was because of they were not aware that a painless lump could be cancer. So whose responsibility it is? It is our responsibility to translate the information to the community, and that's where the cancer awareness stands up. And we have been doing this last 5 to 6 years almost like religiously, and we have made a huge impact and huge change. And then we also, one thing that when I started BCH was that we cannot be thinking of pink alone, because when I first thought of breast cancer hub, it was like it has to be from all for all genders, and male breast cancer is a very important aspect, but most of the men, they are ignored because 1 out of 833 men can get breast cancer, and that's the statistics, but that shouldn't be the case. And then that one man may be a father, a brother, or a son of the family. So here I have Cherry Ambrose, who is an advocate for male breast cancer. So like it is such a so I think we are the so we always collaborate with the male breast cancer, all the associations that exist in US, and also we try to do it globally. Now over here, if you see the picture, his Marlin Washburn and his wife Patricia has given me the permission. So Marlin's picture is in the car because we lost him in the span of 5 months from the date of diagnosis. And it was not that, Marlin was not aware about breast cancer, but he did not know that men get breast cancer too. And when detected, it was so late. So Patricia travels all across the US with the car and Marlin's picture so that men get to know that they get breast cancer too. And it is my motto too, like whenever I'm traveling across, I carry the message, that men get breast cancer. And that's why on our logo, we have the blue along with the pink streak. So that is the purpose, so whenever we talk about any screening here, we are going to talk about all genders, and we cannot exclude men or LGBTQ plus or anyone. So now why early diagnosis is important, right? On the scientific ground, what is the statistics and what happens? So basically, this is like our breast tissues. Our breast tissues are made up of lobules and ducts. Now, lobules are the milk producing, and through the ducts is going to, collected under the nipple. Now, what happens is when we go for the screening process, we can really, for example, the mammogram, which is the gold standard for the breast cancer screening, which is the X-ray of the breast. That point, we can really detect the tumor in the duct or inside the lobule. So we call it as ductal carcinoma in situ or lobular carcinoma in situ. That means it is inside. Now, if we wait for longer, what happens is the tumor starts to invade. It becomes invasive ductal, invasive lobular, and then through our lymph nodes, which are under the arm, it can spread through the circulatory system, through the bloodstream or the lymph nodes to the distant organs. Now, with breast cancer, the stages are stage 0, stage 1, stage 2, stage 3, stage 4. Now, from stage 0 through stage 3, we can really save this person. And stage 4, what happens is that means the cancer has traveled to the distant organ. We call it as metastasis. Now, it's very difficult to cure the patient at that time. It's more like, maintenance, to help the patient live a sustain the life, through the quality of life and all of that we try to conquer. Now, so you can understand, right, why the detection early, because we can easily cure the person. And the earlier we detect, the better the prognosis is, the easier the treatment protocol will be. And that's why it is important. So that means when breast cancer, when detected early and treated accurately, is curable. And this is the statistics, because we always should take the current statistics. In 2022, even in the developed world in the US, the statistics is this many new cases are supposed to be detected with breast cancer, but still we are expecting 43,250 death for the female, and also, for the male also we are expecting 530 death for the for female it is 43,600, and for male 530. So just imagine if in the US this is the situation. So what I see through the research that we have been doing, or from the outreaches that I have been doing in the developing countries, the death rate is significantly higher because of the late stage detection, and also there's a lack of research, because we really, that's where on the grassroots I'm working on the research side too. So this is the current scenario, and this is the survival. When we think of the survival of the developing world or the outside world, US is very particular with the data, but what I see is 60% survival in India. But when I'm going actually in the different parts of the India, I always hear my mom passed away, my sister passed away, but where is the data represented? So what is the real scenario? That is still very skeptical. So, but it is high, the death rate is significantly higher. And even in the US also, we really have to take care of the scenario. So this is what is going on. And that is the reason why early detection is so important, Dr. Bhaskar.
Absolutely. No, thank you very much for explaining all this. It is really important because, as you know, I have myself done the cancer journey twice, once as a doctor and once as a patient myself. And luckily, in my case, it was detected early on, or in a way, I detected it myself early on, and that's the reason why it could be operated and taken out. And that's where the whole difference is. So, from what you have said, the main points that I can take from this question is that number one, breast cancer is not just for women. It is something we need to know about in men as well as in LGBTQ as well. In fact, when I was publicizing about the seminar, about the webinar, I got two people who came back to me and said that they're really pleased that we have got the LGBTQ within discussing within this. So that's a very important point. The second point is about the fact that it's happening with the data that we can see. It's still quite rampant in developed countries. So with the absence of data in the developing countries, so it must be really high. So it is very, very important that we bring about the awareness. I know it for myself, that the negative connotation that the word cancer has, because it took me about 3 days for me to tell my family about cancer, and when I did, all hell broke loose. So yeah, things are getting better, but even now there's a long way to go to kind of make people understand that cancer is just like any other medical condition. It is still treatable as long as we can detect it early. So thank you very much for that question. I would move on to the second question, which is primarily in the UK. As you know, UK is a state-backed health service, which is slightly different from the way it works in India or in the US. But UK, we have a national breast screening program, but it starts from the age of 50 and to the age of 71, where all women are invited every 3 years to have their mammogram. Although the uptake is still quite low, and if somebody is binary or transgender, then they get automatically invited. But I have in my own practice, I have seen breast cancer. The youngest I've seen is 23-year-old. So, what's your advice regarding that? Because these people won't be invited automatically for screening. Yeah.
No, that's a very good point. So we have, so you saw at the age of 23, I know men with breast cancer detected felt the lump at the age of 18, at the age of 17. And also a woman I know at the age of 18 in India, I met her, and we lost her because she had no clue that it was breast cancer. So we definitely, so that was the purpose, other purpose also, so I will tell you, I'll take you to the steps actually what we did. So what is the protocol. Now in the UK, what they're following is that, what I understood is 50 and like between the ages of 50 and 53, they're invited for the breast cancer screening, and then invited every 3 years until the age of 71. In the US, it's after the age of 40, we have the options, and then women 45 to 54, we get to do mammogram every year, and 55 and older, like we switch once in every other year. But things change, protocols keep changing. So we have to keep updating ourselves. But as you said, the younger women, now in our support group also, we have a breast cancer hub support group, or I do one-on-one with patients reaching out. Many that we see are in the 30s, in the early 40s. So what do we do about them, right? So I'm going to take you to the steps of the breast cancer screening processes. The screening processes are that after the age of 40, the gold standard is mammogram. But what happens to the younger women? In the US, doctors are doing the clinical breast exam, because we go for a physical every year and doctor will check our breast, for the examination. But that's not the case for the, for the male. So that's why we are advocating, so that men get clinical breast exam too. But in the developing countries, when I'm talking to my colleagues or friends, or in my family, like gynecologists, and if a patient woman comes for any other concerns, can you do the clinical breast exam? This is the reaction. Like, why are you touching my breast? I did not come for breast exam. I came for some reproductive organ problem. So there's a huge stigma. See, we cannot fight the culture, but we have to give a solution. And that's the purpose that, we have to invite to. So now what we do is, the solution that we brought is the breast self exam card. We have it in 24 languages, and I'm going to explain every step of it. But I want to say that, we developed it in collaboration with other male cancer organizations, and also, with Sarah Cannon Cancer Institute. And for the first time, we have it for men and women, for him and her both. And we have, with the help of our breast cancer hub volunteers, we have it in 24 languages, so that, we can penetrate regionally, so that those who do not understand English. But before going to that, I also want to highlight something very, very important, because this is applicable globally, and this particular slide has saved innumerable lives. Because mammogram, which is the gold standard for breast cancer screening, did you know that mammograms can also miss cancer? And we have patients in the US who are also in a support group, who went for the mammogram religiously. They did the mammogram, but the mammogram missed cancer because of dense breast. So what is dense breast? Now, what happens is, our breast tissues are supposed to be made up of fatty tissue. Fatty tissue means, like when we have fatty tissue, it's in the X-ray, it appears as a black background. But most of, like 60% of the women population, we have dense breast or fibroglandular tissue. So when we have that, our X-ray appears as white patches. So if we have heterogeneous, it will be white. It's distributed in this way. If it is homogeneous, it will be like all white, all covered. Now, why am I talking about this? Because when we have a lesion or the tumor, it appears as a white spot. So similarly, it's basically finding a snowflake in the snowstorm. And that's why it's very important. In the US now, the regular mammogram is becoming redundant in many hospitals. For example, in Charlotte, in the Novant Health, they are giving the 3D mammogram, which is the more advanced tomosynthesis, we get a better resolution. So I would request that even the NHS in the UK, if we can do the advanced like 3D mammogram to get a better resolution. Or in India, what I do in the developing world, what we say is that, because not all the hospitals will have the 3D mammogram. So in addition to the regular mammogram, if we know we have dense breast, we have to do an additional ultrasound or sonography. So that will really help to, and sonography, ultrasound is available everywhere globally. It's much easier that way. So we will not understand if we have dense breast or not until and unless we do the mammogram. It helps to define the structural integrity of the breast. And if we know if we have dense breast, definitely we have to do additional ultrasound if we are not going for the high-end 3D mammogram technology. So this is very important, because I know women in the US, we lost because they did mammogram, it missed the cancer. So that is a very important message that I would request everyone to share through. Now, next is the younger population, right? As you said, like younger women get breast cancer, and it's becoming globally so common. So what do? those who have a genetic history. For example, if in a family they have the ovarian cancer or breast cancer, we just have to be very proactive and let the families know that they need to get the BRCA mutation testing done and also a panel of genetic testing done. And the men of the family should get it too. For example, the offsprings who are sons, because the son can also carry the genetic mutation. In that case, they are not only prone to breast cancer, but digestive tract and other types of prostate cancer and other types of cancers. And this handful of population, they have to go for screening earlier. But another important thing is it's only 5 to 10% is genetically inherited. Randomly, 80 to 90%, anyone can get breast cancer. So what do we do? And that's where this comes in, our breast self-exam card. In a very correct protocol, how to do the breast self-examination is very important. It's not that we just remembered and we will go ahead and do the examination. It's 7-day post our menstrual cycle. If a period starts today, it's 7-day post, because a lot of times there are many hormonal changes happening during our periodic cycle. And then for the women with menopause, we have to pick a date in the month. For the men also, we pick a date in the month. So how do we do it? We look for any discharge from the nipple, any like other than breast milk, any blood discharge, like water discharge, transparent discharge. Then if there's any discharge, please report to the doctor immediately. Then sudden retraction of the nipple. If we have a nipple retraction since the childhood, that's not a problem. Any sudden changes, or so that means we have to understand the look and feel of our breast to detect any abnormality. Any sudden nipple retraction, any dimpled around the nipple area, redness around the nipple area, any pain or painless or painful, doesn't matter, any abnormality. Then in a sitting position or in a sleeping position, many patients have told me they like the hardwood floor. We take our hand behind our head and then we follow the collarbone, because we have to make sure that even this area and the underarm area, because basically the full chest area in a position like that, we have explained with the arrow, and I'm going to share all the links with you so that you can share with your network and go from up top to bottom and look for any lump, like for example, like a marble, hard like a marble, which slips in your finger. If you see that it doesn't dissolve in few days, immediately go to the doctor. If you are younger also, tell the doctor, I just need an imaging test. And if the imaging test comes negative, but ask the doctor if you have dense breast or not, if you have, do an additional ultrasound, but please follow every month, do the breast self exam to feel that lump if it's increasing, because 95% it will be non-cancer or benign. 5% maybe it's cancer, but even if it is benign, we have to do a follow-up very diligently and go for the follow-up ultrasound or mammogram. So this is a solution. We have it in 24 languages and it works wonders. So this is something that I would say really, really is a step for saving lives.
Thank you again, Lopa. I think that's a really important point about the self-breast examination. A couple of points a couple of observations there. One is, as you said, we should be doing opportunistic breast screening whenever possible, especially for the doctors. But being a male doctor myself, it would be sometimes it would come up as inappropriate if I suggest to a patient to go for an examination. But I can always suggest self-breast examination, which I used to do, and most of the time they would do. It is very important for them to understand how to do it, because many of them is to come back to me and say that they have felt it with their fingers and they have felt something knobbly and now they're worried about it. So then I used to tell them, no, it should actually be the palm of the hand and how you do it. So that brochure with all the important information would be really, really helpful if we can make it available to as many people as possible. In terms of the BRCA2 oncogene testing, that's also a very important point. I think in the UK, it does get offered to people, anybody who is diagnosed with breast cancer, and then their siblings or their offsprings are offered that as well. I'm not sure whether it's offered to men or not. That's something to find out. In terms of the dense breast tissue and the mammogram, again, I think before the age of 50, often the mammogram is not the most sensitive test. So therefore, the 3D mammogram is really important. But it is not not as available as it should be, especially in the developing countries. So for us in the UK, and I suppose for India as well, or other developing countries, sending people for an ultrasound is probably the most cost effective one. If you, do you agree to that?
Yeah, that's what I tell everyone. But
Yeah.
what happens is, Dr. Bhaskar, that initial mammogram is needed because there are a few things that we cannot capture with ultrasound. For example, the calcium deposition, then also the structural. So once
Yeah.
we do that, then, for the follow-ups, in addition, we can definitely go for the ultrasound. But ultrasound is definitely, I tell everyone to do ultrasound in India because it's much cheaper, it's cost effective, and it's much more accessible also.
Absolutely. Yeah. I think the accessibility is a very important point. In the UK, we follow a 2 week breast lump pathway. So anybody who presents with breast lump, any sort of palpable lump or breast pain, we refer them for ultrasound, and they usually get the ultrasound within the 2 weeks. And if the ultrasound is not conclusive, then they go for further test. But ultrasound is the first thing that we would suggest. So I would definitely advocate the more and more publicizing of the self breast examination card, and would want to do that for both male and the female. So thank you very much for that. Um, so if we move on, uh, the many developed countries have got a very good public health program. But there are countries where they don't have that much public health program, although India is one of the countries who is known for its public health program. But there is the question of affordability, especially if they don't have any symptoms. So how do we tackle that issue?
Yeah, so that's actually the main mission of Breast Cancer Hub. So we had this vision. So I would also bring it up that we are doing global efforts we are putting in. So we are also working in the US a lot too, because we cannot forget the population that gets missed even in the US. So Africa, India, and US are our primary location of going penetrating and working globally. Through the hybrid manner that we are doing is through the webinars. So I have been conducting webinars through and through, and then taking accountability. So every time after the webinar, everyone has my email addresses. If anyone needs my WhatsApp number also. So they reach out to me if they have any concern, because it's not about just doing the webinar or awareness, right? It has to be that what do they do? What is the next step? So they reach out to me, and then I try to help and navigate them towards the healthcare resources. So I try to build a network. I have a BCH India, BCH US, BCH Global networks where I connect them and also do a follow-up. So that is kind of like a sustainability mode. But what I actually do, I would say, is that, here you see this, right? So basically the breast self exam card works like magic. And that's what you said, that, in the areas where they have no knowledge about any symptoms, they are not even aware what cancer is, because food is their priority, not all of this healthcare system. So what I do is I go penetrate to these areas and go and give them with the local language, the printout of the breast self exam card. And for example, you may ask me that the villagers, many, even if you give them the local language, they do not know to read and write. So what I do is that I'm like doing the campaign even in the youth. So I give the cards to the small children of theirs, because they go to the local school, and I teach them, I tell them, you be the advocate, and you cannot imagine the response I get. And then, for example, they will not be able to access email, right? So what I do is, they have my WhatsApp number, but not everyone has my phone, has their own phone, like mobile. So the head of the villages will have the mobile. So they have my phone number, they have my WhatsApp number, and WhatsApp is free, which is great, because for us revenue is a big problem. So that's why what happens is that, even in the middle of the night, I'll get phone calls that you came to my village and now I'm having this problem, what do we do? And then I connect them towards the nearest health, because when I'm doing these outreaches, I'm also connecting to the healthcare system. So I know the contact, and then I will connect them, and I will make sure, because they are below poverty line. So basically they will come under the government scheme. But then the initial investigation, they do not have the money. So that also Breast Cancer Hub provides with a little amount that we can, so that we can take them through this process, then hand them over under the government scheme. But I do a follow-up, making sure that they are medically treated correctly or not. So that is one way we are doing it in India. In the US, our outreaches, even in US, we have shelters, right? So I work in the shelters, I work with artisans, I do the community outreaches, I work with the schools, colleges, and all of the places. And trust me, the breast self-exam cards work magic even in the US. And in Africa, we are diligently doing outreaches. I work very closely with Sierra Leone. We have, collaborators over there, work in Nigeria and Kenya. We help with the patient treatment aid, with the patient treatment, and do follow-up. So in Sierra Leone, we have amazing, I know someone called Cremelda, she is like collaborating with us. And it's a wonderfully that we are doing the work in Africa too. Now, as you said very correctly, right? I mean, it's not just awareness will not work. So when I was doing all these outreaches, so basically with our mission, what happens is that nothing is pre-planned. It's totally based on the circumstances and based on the need of the community. I kind of keep improvising. So when I was doing this particular session in a tea garden in southern Assam in Kachar district, and you know the tea garden, how difficult their maintenance is. So when I completed the session, one girl over here, 18-year-old, she started to cry, and she was like, why didn't you come to my village last year? My mom just died. And she was like, and she said, because she did not know a lump could be cancer. And I got so emotional. I said, I couldn't save your mom, but no other moms will die from your village. And that's how we started the Villages Adoption Project, where we go door to door. And when we were doing that, we realized that it was not only breast cancer, about other symptoms they were talking about. For example, cervical cancer is a huge deal in the villages. So oral cancer, because in Northeast India, is all tobacco. So esophageal cancer. So we started to work with all type of cancers and created educational cards, screening cards for other types of cancers too. So now when we were going door to door, we have the local field workers trained in the local cancer hospitals, and ours is a volunteer driven organization. But their local field workers are the only ones who get compensation because they are trained there. Instead of hiring our resources, we are making them do the field work. And it's a great feeling because the trust builds up, because they are the village people themselves. Now I can proudly say from one village, we have adopted 11 villages. From 0% to zero awareness, they are now 100% aware for all type of cancers. And we are planning to adopt villages in Chennai. I'm traveling to India soon, Chennai, Orissa, West Bengal, in future in Rajasthan also. So this is how it has been very successful, but challenges, right? Because when we were going to their door and telling them that, okay, you might be having cancer, they were like, we don't care, because how are we going to even go to the hospital? Because our daily wage is the main big problem. And who is going to accompany me? Because we cannot send two people to the hospital, and that means the two wages will be gone. So that's when our field workers, our staff would take them to the village, conveyance them, because it was all in COVID, super expensive. We took them to the hospital. Then we were the ones to communicate, generate the income certificate, make sure they're getting the government scheme or not, feeding them, bringing them home. So, and then doing the diligent follow-up. So this is how I feel that, it worked wonders. We have been saving lives, holding the hands of those people who have no one to take care of them. And this we are doing in India and Africa, like mostly in these two countries. And then in the research also, we are working at the grassroots. I think that is where the changes we are doing, so that we can make changes in the healthcare policies. So these are the different ways, Dr. Bhaskar, where the sectors which are totally untapped, we are taking care of them.
No, that's brilliant. The work that you're doing is really, really commendable. A couple of things there. One is, as you said, in some communities they're so poor, or the accessibility is such a big problem. They would rather carry on working and die than to waste a single day wage to go and get this treated, especially if they don't have any symptoms. So education is very important. But what is also important is to make it as accessible as possible. So I was just wondering whether it would be useful to have seminars with doctors, to see if these doctors in these particular areas can, as a part of their philanthropic work, can either reduce the cost of the scanning or maybe do some free camps and that
Yeah.
sort of thing?
So
Because
yeah, we are doing that all the time, Dr. Bhaskar. So the
yeah.
areas that we adopted, so we are tied up with the Indian medical associations. So for example, like last year when I went in November and December to India, so we collaborated with IMA, and then we did the screening. Okay, so I think there is a message also. So we did the screening, cervical cancer screening, the pap smear, HPV test. So we took the team over there, and then it was really wonderful. So all the suspicious cases, we brought them there. So we have been regularly working with IMA, working with the local cancer hospitals and doing all of that. Yeah, is in collaboration.
Also, I think you are doing a lot yourself, wasn't it? I mean, as you said, you are now working without getting paid. You are taking phone calls in the middle of the night. You are coordinating everything. So, have you got enough support, or are you working on building up the infrastructure so that there is a bit less reliance on you, so you can get some time for yourself as well?
No, so I have given, so basically we have oncologists, we have physicians, we have many in our support group, and a lot of people step up all the time when I need. Basically, see, everyone has a full-time job, right? So they have to take care of that also. So in addition to that, whatever help they can, they are doing that. Yeah, so we have a huge network for sure.
Okay, that's brilliant. Thank you, and I'm glad I'm a part of that now as well. So hopefully
Absolutely.
we can make this take this further. So moving on, as we have mentioned once or twice in the conversation already, the word cancer has a very negative connotation, and many people would prefer to be in denial. They would rather not know than know and suffer more. Also, there is this kind of attitude that if you go and speak to them, talk to someone about cancer, they will say that no, it can't happen to me. They always think it's somebody else. But as we know, the prevalence of cancer is increasing day by day because of various reasons, including the environment or genetic mutations. The prevalence is increasing to the point that some studies say that almost 1 in 2 person will have cancer by the age of 2050. So it is a huge problem that we have. But this denial and the fact that it's not my problem, it's somebody else's. So how do you address that bit?
So basically, I always show the reality. So whenever I'm doing the cancer awareness program, what I do is I start with a tribute, because that tribute is an eye opener. Because then people realize that what happens is that it is real scenario. Because I know a lot of organizations, they tell me that when they're going for a cancer awareness program, people do not want to listen because they're scared about it. But then in alongside to the tribute, I'm also showing the survivor stories. I think that makes a huge, huge difference. And I will just show you how actually we do that. Is basically, like I took interviews all across, like even in the US, even in India. I tried to understand the mindset of the women who are going through breast cancer or any other type of cancers, like what actually went through the retrospective. And based on that, the gaps that I felt was there, I kind of built certain programs. And the way I'm doing the presentation is that then I'm telling you, Dr. Bhaskar, those areas where even in the educated sectors, even when I'm doing webinars with the doctors, I have been constantly doing webinars with many doctors forum. Even over there, many women, I ask them, how many of you have done breast cancer screening after the age of 40? Except few gynecologists, no one would raise their hand. It's more diagnostic. So what I'm saying is that people, many are aware, but still they will not go. So how
Mhm.
to do the push? So that's where the reality that is going on within the community that I show. The importance of the support group, which is so, so important, because when someone is detected, there's a lot of hiding, the taboo that I do not want to tell anyone in my family, in my extended family, because cancer itself is considered as a taboo. So that's where I started to speak to the patients, and they told me they were from very local small towns in India, and they said, I really want to talk to other breast cancer patients, but their family was like, no, she doesn't even want to talk about it. But then when I started to talk to them, they were like, the women, they're like embracing me. They couldn't stop talking in the interviews. So what I did was I tried to penetrate them. I kind of was very stubborn in my approach. I did not listen to the families. I went directly to the patients and I understood their mindset and I built a program for them. So we have many local support groups, and this is so much strength there in the underprivileged areas they get. But also we have a very private virtual WhatsApp group where I know that we are connected like a family. And for us, only 5% of our work is published on the website. Everything is patient privacy. But also there are many, who reach out to me separately. They do not want to be a part of the support group too. So they are all anonymous. But what they do is I create small groups for them. So I go and meet them, but I connect them to the specific people I know they will be comfortable with, so that way there are many ways I'm trying to do it, Dr. Bhaskar. The other thing is the breaking the myth in the society. Many think that, my daughters will not get married because I have breast cancer, or else even many times the marriages are broken because the woman got breast cancer. And I tell them it's only 5 to 10% genetically inherited. In fact, you are lucky if you bring someone from the family who is aware, because that woman will never get detected late. Because and that also, it can be a random thing because it's only 5 to 10%. Maybe it was just random for the mother also. So scientifically speaking and breaking the taboos and telling everyone that also the other myth that cancer is not contagious. These are because women live in isolation, men live in isolation when detected with cancer because the society thinks cancer is contagious. So breaking those myths at the grassroots level, this has really, really helped. Publishing the stories of our advocates, our survivors. What I cannot do as a scientist, what many physicians, oncologists cannot do, a survivor story does that. If someone is reaching out to me from a remote part of India, she's saying that my mother doesn't want to get treatment, but she only understands Assamese. I will send her the family, the stories spoken in Assamese saying that I once had cancer, I forgot about it. And then the person comes back and says, now my mother wants to do the treatment. Because another survivor has mentioned that. Even if when the doctors say it doesn't make much difference. So what I'm saying is that those are the impactful journey, like your story, Dr. Bhaskar, we posted it. So if someone detected with thyroid cancer, I'm going to share it. So that becomes the motivation. So this is what the survivor stories do. And I'm so proud of our advocates also, those who have come up, forward, who are supporting each other, through the journey. And because without them, that is how our breast cancer hub actually, for me, our advocates are our heroes. For example, Christine, she shared her story and she told that, like her strength were her kids because they would wear the t-shirt like strong like mom. So what I'm trying to say is that these are the small things, because cancer journey is not of just the patient's journey, it's the family's journey, it's the palliative care. The bridge is shaking. We have to give support socially, morally, the community, the family members, the caregivers needs equal strength, right? So, and she would say that it's her kids who gave her the biggest strength, because when you have the strength within you, you can really pass on the journey, because that is the most important thing. Even Jessica's story, Jessica is leading a very normal life. She's cured now. She's also having a baby now. She had a baby also recently. So what I'm saying is cancer is just a word. If we get treated, we will be cured and we can resume our regular life. Of course, it's difficult, but it is doable. So that is how I try to imbibe all the different aspects when I'm doing the sessions. And at the end of the session, that makes a huge difference. Yeah.
You're absolutely right. And I really commend you again for with the passion that you're talking. Itself shows that how much dedicated you are onto this cause. So I think at the end of the day, it all comes down to education, education, and education, isn't it? It is about making people know the realities, making people know of the statistics, breaking the taboos and the myths, as you said, and the advocates play a big role. I I have one. I know one person who we've done MBA together. She's 68 years of age. In between doing the MBA, she got diagnosed with breast cancer, and she was very close to me because she knew I was as a doctor. So she also used to get used to chat with me. So far she's had 27 operations, but she's doing so well. On top of completing her MBS, she has now got into doing a PhD program, and her story is so powerful that has inspired so many other people. So, and you are also right about the impact that it can have on families, on the partners and stuff like that. So I've heard many stories within my patients as well, where the partners have left because the patient had to have mastectomy, or or patients have gone into severe depression to the point of self-harming because they don't feel like being a woman anymore, those sort of things. So these are all really sad stories, but at the same time there are lots of people who have kind of found themselves, or they have rediscovered themselves after getting the diagnosis of cancer and going through all these treatments. So I think the more and more we can use these stories, the more awareness there will be. So that is really important. So thank you for touching on all that.
Thank you. And also in our forum now, in this meeting itself, I know we have two amazing from our BCH family, and I don't know if anyone else is there, if Uma ma'am is there too, but we have advocates who are breast cancer survivor in this forum now, and I don't want to disclose the name, but then also we have another advocate who is a caregiver. So we recently had a caregiver webinar too. So so that's the strength, I was talking about, Dr. Bhaskar. So I'm blessed to have many who has joined hands with Breast Cancer Hub. Yeah.
Absolutely, absolutely. I think that for it's a journey not just for the patient, it's a journey for the family. From my own experience, as I told you, it took me about 3 days before I could disclose it to my wife and my kids. I didn't tell it to my kids for a long time, but to disclose it to my parents and my wife, it was actually first a friend of mine who is a chemist. I called him to say that on top of the spinal cord injury, now I've got this. I don't know what to say. And eventually I had to say it because my wife had the insurance in her name. So in order to get the treatment, I had to tell her. And the moment I told her and my brother, everybody thought that this is the end. That's it. He's going to die now. So so it is very, very important, to kind of bridge those conversations, trying to understand the impact it has. And I think the carers or partners, they go through a hell of a journey because the patient lives it for themselves. The carers, they live it on behalf of the patient. So it is very important that we can support them as well. So on that ground, I just wanted to also talk a little bit about the risk factors. We've already touched about the risk factors. So do you want to talk a little bit more about risk factors of
I
cancer
can,
in general?
yeah, I can just brush through a little bit, not taking much time, but I wanted
Yeah.
to bring one important thing is inflammation. I know this is not talked much anywhere else because, like my work was at actually, I discovered the mechanistic link, the signaling pathway between arthritis and breast cancer. So I always say that, if there is and this work got press release in ACR, American Association of Cancer Research, in 2012. So why I bring this up, because when there is any other chronic disease in the body, when we have cancer, we forget about the other disease. It adds fuel in the fire. If any of us, we have any chronic inflammatory condition, asthma, diabetes, or obesity is also underlying inflammation, connected to inflammation, please target that, because that also helps with the treatment for the cancer. So it is very important that we really connect the dots. And also the most preventable cancer, there are many preventable cancers, because the number one, because I'm doing a huge anti-tobacco campaign in India, in the US, and globally through the cancer awareness sessions that I'm doing. So tobacco is number one. So when a lot of times when you tell me, oh, I was smoking all throughout my life, but I had bladder cancer, not lung cancer. People do not realize that smoking can cause bladder cancer. It doesn't have to be restricted in the lung. Many times, chewing tobacco, like when I'm going to these places, in the urban society, that they're chewing tobacco and talking to me, and they're like, oh, no, don't worry, I'm not going to get oral cancer, don't worry about that. I said, how can you be so sure? Sometimes some people say that I'm 80-year-old, I chew tobacco all the time, nothing happened to me. You are lucky, because there are so many other variables, there are so many other factors. Maybe you do not have a mutated gene, or maybe the environment that you're working on is safe, or maybe you are not exposed to stress, because all these different variables are the underlying factors that contribute towards the development of cancer. And the different factors can be inflammation, alcohol, family history, our stress is a master regulator. Stress leads to the different oncogenic upregulation of oncogenic different pathways. Then the work environment, if you're working in an atomic center, or if you're working in an industry, like for example, in Bangalore, someone came to me and said, my mom had lung cancer. She never smoked in her life. You don't have to smoke. So I found out that, she was working in a factory where she was inhaling smoke all the time, and there was no biosafety over there. So we have to be very vigilant about the environment we live in, about the water we are drinking, because the arsenic in the water, or there are so many other contaminants, the food we are eating, like the pesticides, that also plays an important role. So these are the different things, that contributes. And most importantly, our diet. I have seen the young generation, or even like when I go to India, the McDonald's, there's a line till the road, for the junk food. The amount of junk food people are eating, like it's not that I'm telling everyone to stop eating all of that, but keep a balance, and not like the preservative paste. Like for example, ginger garlic paste, there's so much preservative in that. Why don't we have fresh ginger, fresh garlic, fresh turmeric? These are antioxidants. Curcumin in the turmeric has antioxidant effect when you add it with we add it with the peppers. Now, it doesn't mean that turmeric will cure cancer. I'm not saying that. Then no Indians would have had cancer, because we are having turmeric from day one. Since 6 months we are eating food, because all our curries are turmeric. But what I'm saying is they help, they're antioxidant. But I'm not so much in favor of taking the capsulated version. For example, take huge amount, but always we should remember that when we are going through the cancer treatment, we should be careful that we are not doing any supplemental cancer treatment in the form of homeopathy or Ayurveda, because we have not done research where we haven't seen what is the cross reactivity. Because like many times these are high in antioxidant which will protect the cells, and our purpose is to kill the cancer cells. So I'm not against any of that. We can have all of that, but once we are treated, so that with the relapse situation it can be helpful. So I'm just telling everyone, requesting that keep a balance in your life, that make sure that you are not inclining towards very unhealthy food, but even if you're doing it, keep a balance. And that doesn't mean that someone asked me in one of the awareness sessions that, I'm exercising every day, but I'm smoking also one cigarette. Is that okay? Because I'm exercising. No, it doesn't count like that. One cigarette or two cigarette doesn't matter. Tobacco is tobacco. Again, when we are leading a lifestyle where we are eating good food, but if we're torturing our body with lot of for example, what happens is, this is a simple strategy. Inside our body, there are free radicals formed which will go and damage the DNA of the cell. Now, the antioxidant will contribute a free radical and balance it, stabilize it, so that it is not available to go and damage. The more and more bad food we give, the more and more free radicals are generated, and our body doesn't have enough antioxidant endogenously to protect the DNA, the damage done. So this is a simple phenomena. So it is not a one-day thing. It's a journey. Over the years it can develop. So that's why our lifestyle, our healthy lifestyle is so important. Now, we should also remember, a lot of people will do everything right, but still they will get cancer, and we do not know. So there is a bucket, which is unknown. But whatever we know, I just request everyone to, little bit try towards making that happen from our side at least, so that we do justice with our own body.
Absolutely. And I think that is the reason, all these environmental factors, the lifestyle factors, the adulteration in the food, the pesticides, all these different chemicals that come in contact with us on a regular basis. These are all the factors, and on top of that, as you mentioned, the stress plays a big part, because there has also been studies going on how stress can affect the neurochemicals in the body, and can lead on to cancers and stuff. So I think again it is very, very important. I think in many cultures there are certain things which are even more difficult, because say for example betel nut chewing is a part of culture of Assam.
Yeah.
So it's very hard to tell people not to do it.
Yeah.
But we have to, as I said, if at least we can reduce it. If And similarly with fast food, with processed food, it's the same thing. So if we can at least reduce the uses of it, then perhaps the prevalence of cancer will go down. But at the moment, it's going dramatically up. It's exponential in its prevalence, and it's going to be almost 50% of the population is going to be affected by the age of 2050. So it is really important. One last question before we move on. Uh, in teenagers or in young women, we often do get lumps, and most of the time they end up to be fibroadenoma or related to periods and stuff like that. So can you talk a little bit more about lumps in that age group, as well as about pain during menopause or premenopause? Because I used to get lots of patients who used to come in with pain during menopausal times, and that's not necessarily always cancer, but it is always at the back of the mind. So just to reassure people.
Yeah, so that's a great question. So what I do is I always tell everyone, if you're having a lump, we can feel a lump that is not going away for the next 10 days, then immediately report to the doctor. So we have to at least maximum for 14 days, because we cannot leave it like just like that. But during our menstrual cycle, we should not, if you're having a lump, we should not worry as much, because the hormonal changes will have a lot of times. There are many lumps that which come up, pull up because of the estrogen, progesterone, and during the hormonal periodic cycle. So it will disappear, it will dissolve. And that's why when I talk about the breast self-examination for the younger population, I always say do it 7 days post your menstrual cycle. So if a period is starting now, so 1, 2, 3, 4, 5, 6, 7, on the 7th day, we have to do that. So that actually, itself leads to we can ignore the false negative and the false positive, the stress that we go through. So that is one thing that I would always say. Now, if there are some reproductive pain, during the menstrual cycle, like it doesn't have to be related to any breast ailments, but any women, those who are in the menstrual cycle and they're going through any reproductive pain, that can be for many reasons. Endometriosis can be one of the reasons, or many cervical issues can be there. But I always say that every year a physical checkup is very important. So that physical checkup with an ultrasound, that will really clarify a lot of the things. And we talk about other types of cancers too, but with the breast lump, I always say that, if there is a pain, so we should remember one thing: painless or painful, both we should worry about, because cancer is a is a quiet development. It is within the body. Our immune system will never respond. It's not like COVID. We have COVID and we are responding. Like I'm having COVID now. I'm getting constant fever because my body is fighting that, right? So, but with cancer, this will not happen. So, any development which is a silent growth, if it goes unnoticed, it is a big problem. So, basically, anything that is remaining for some time, for 10 to 14 days, immediately report to the doctor, do a mammogram, ask for the dense breast situation. In addition, do an ultrasound. So that will be the protocol.
Thank you. For all our audience, I request you to open the chat box, and if you have any questions, please put it in there.
Yeah, and I also would like to just mention about, if the time permits, for a little bit about other types. So I just want to mention the
Yes,
audience.
please. Yeah, we are just moving on to that. Yeah.
Yeah, we have other types of cancers too. For example, we developed early detection screening cards for all type of cancers after a lot of review, research, analysis. We have self-oral cancer screening card because I come from Northeast India, I come from Assam, so I know how bad the situation is. And in India, in the US, we go to the for the dental hygiene, but in other parts of the world, if when our tooth is falling apart, with pain, then we'll go to the dentist, right? So, but then we can do our own self-oral cancer screening. So how to do that? So these are the different protocols. I'm not going into detail because it will be like forever. But then we have like the main prevalent cancers, like the colon cancer, the stomach cancer, because I have seen a lot of cases in the US detected late with colon cancer. They were having rectal bleeding, but it was getting missed, thinking is hemorrhoid, or because in colon cancer, the colonoscopy, which is the screening protocol, is after the age of 50, and I see young population getting it. So we have developed these cards where we also have what next, so that we can empower our community, that they can go and talk to the doctor that, okay, I need to do this, I need to run this test, so that nothing is going undiagnosed. Because because a lot of times with colon cancer, stomach cancer, what happens is there's acid reflux all the time, and we go to the pharmacy and buy antacids and we keep having it. Family history for the stomach cancer is critical. I know someone we lost in Charlotte in North Carolina. We lost him at the age of 45. When I first met him, he was already, advanced stage. And when I asked him, he said his father passed away in India at the age of 45 with stomach cancer. And he had the mutation very much present, but no one discussed about this. And we lost this person also recently. So these are simple, small measures, small variables we cannot ignore. Similarly, with cervical cancer, I really want to bring up that vaccination is available, the HPV vaccination for both boys and girls. When it comes to the HPV vaccination, what we think is that, it is always for the girls, but before they are before they are sexually active, we really need to do this vaccination. That is a preventative measure, because to protect ourselves from the human papilloma virus. So we have developed these cards. Please go through it. But our overall, I would like to say, please do a health checkup every year, and that health checkup contains for our clinical breast exam. If we are 40, then for the mammogram, ultrasound, then for our full body blood work, because the hemoglobin, lot of times the solid tumors, they need a lot of nutrition, the blood, the hemoglobin goes down. So the blood count, checking the blood work is very important. Sudden weight loss, if our body suddenly, we are not trying to lose weight, but there's sudden weight changes in our body, unexplained weight loss, unexplained, like we do not tiredness, fatigueness, all these are, because we cannot go to each type of cancer to define the symptoms, because it's all there in the different detection cards. But what I'm saying is anything which is persistent, like very recently I know someone, they missed the throat cancer, because why? Because they thought it is allergies, because our North Carolina is huge with allergy. So these are the different things that I really request everyone to be very proactive with your health. I know no one likes to go to a doctor, Dr. Bhaskar. My father was a physician. I know that, no one, and I myself don't like to go to a physician, but we have to when something that is persistent, that is bothering us. Now the recurrence, right? So I have patients who reach out to me saying they're survivors, they're totally cured. But then the follow-up is very important. And I always request that the next 5 months, a lot of times we do not do a follow-up with the imaging test. But I say that please do an imaging test, please do a pelvic. If you're having breast cancer, we are totally no evidence of the disease, but still as a follow-up, for once a year, we have to do the pelvic screening, the chest x-ray, because like our breast cancer cells' favorite place are the bones. So always the pelvic scan is important, because we wait for the clinical symptoms. The clinical symptoms will show up when already the tumor has solidified and it's like right there, it's there for some time. So I know we lost some women to breast cancer who were like, they were in stage 3, but they got cured, but then the cancer relapsed in the bones, but it got missed because they were not doing the follow-up diligently. And also the COVID did a lot of loss in our patients, because many times even the follow-ups were not done regularly. So these are different things. I request our advocates to be very careful with their follow-ups, to keep a check on your lifestyle, reduce the stress. As I said, manage the stress, do some yoga, meditation, do what you enjoy. When I talk about yoga, meditation, stress, if my family ever hears me, they sometimes my husband will say, one day I'll come and interrupt your webinar. I'll tell everyone, you yourself do not do any of that. I know it's just that I do not get the time, and it's not an excuse. I know that, but it's important. I request everyone that, lifestyle, like yoga, meditation, then exercise is very important because it helps with the boosting the immune system. Limiting alcohol. Alcohol directly doesn't have a connection, but what it does is it leads to underlying inflammation, which is again a contributing factor. Checking the vitamin D level is very important. So these are different ways. I would say, if anyone wants to take a screenshot of this, so that if you want, you can take that. So please do a diligent follow-up so that we can reduce the risk and the recurrence. And of course, like if someone is in the journey of breast cancer, any type of cancers, we have done so many different areas of webinars from Breast Cancer Hub, and we have webinars done on caregivers also. So I would request that, please go to our YouTube channel. We have all published over there. If someone is going through the journey of cancer, it's not about the patient alone. It's about the caregivers. They need the support. So please, we are there for them. We are there for everyone. Our breast cancer support family, we have caregivers who have stood up for other caregivers. So please connect with us. We are there to help and, to guide everyone at every possible steps. Yeah.
Thank you. Thank you. I think you covered most of the things. It is, I think it can be a completely separate webinar in itself, talking about all these different cancers and how to diagnose or what can be done to raise awareness, as well as different modes of treatment. One very important thing I would say that is about the unexplained anemia or unexplained low hemoglobin. And I think that for that, I suppose the doctors are more guilty than the patients themselves, because many a time, if somebody presents with a low hemoglobin level, or all they're asked is to take iron tablets or supplements. But it is very, very important, and I want all our audience to know that unexplained anemia, or which is the medical term of low hemoglobin or low iron in the blood, needs to be investigated. It means that either you are not producing enough hemoglobin in your body, or you are losing your blood from somewhere. And 9 times out of 10, there is a reason behind it. So please get it checked. That's very important. And other than that, Lopa has already touched on the unexplained weight loss, unexplained fatigue. All those things just need to be investigated further. We have got a couple of questions. One, I think I can kind of answer it myself. I think Anjana has asked about Northern Indian people getting lots of oral cancer. So how to help them prevent from oral cancer?
Yeah.
I think again the answer is about preventing the habits that can lead on to oral cancer, and the number one being tobacco, use of betel nut, cigarettes and everything. So I think if we can reduce that will definitely reduce it. On top of that,
we also have this, Dr. Bhaskar. So we developed the self-oral cancer screening card. So if you can teach that, how to diagnose themselves. But prevention is, of course, tobacco. So we are doing the anti-tobacco campaign all throughout. And a lot of times what I have seen is, people know that tobacco causes cancer, but it's the addiction. So how to actually combat that addiction, that is more important, Anjana. So how we do it is we have a support system that, we tell them, okay, if you're having that addiction, have the drink tea with, liquor tea or something like with honey, or just have the pan, we go step by step. And also, if they have someone to talk to. So basically it's an addiction, the tobacco. So there are different ways we are handling that. So, but no tobacco campaign, as Dr. Bhaskar mentioned, and in the webinar I have been saying constantly, this is the number one killer, because that oral cancer is a preventable cancer. oral
It's a preventable cancer.
yeah,
Absolutely. Yeah.
esophagus, then, you know, like, because it's not only this area, is we have so much of esophageal cancer. It's all because of the tobacco is going inside. Yeah, Anjana, so we are already doing the no tobacco campaign since 2017 with Breast Cancer Hub. So in the villages we adopted, I can proudly say, Dr. Bhaskar and the audience, that, you know, like now whenever it's a very proud feeling that we have actually cut down with the tobacco intake with our campaign. So within, and even I'm doing it in the youth also, when I'm doing the sessions with, I have a lot of students in the US and in India and Africa now, you know, I'm doing the campaign with all of them, and they are kind of reducing the tobacco intake, or they're trying it within their own networks. So yeah, so we have been doing it all the
That's
time.
really good news. That's really, and I think the pollution also plays a big part, especially in the developing countries, especially in northern India, Delhi, where there is a huge amount of pollution. So that's a problem. There is this very specific question from Laura about the ductal carcinoma in situ. The question is, see, about a friend who had a mastectomy, was diagnosed with DCIS, had a mastectomy on the right side. Initially, she was scheduled for radiation only. Now her oncologist said she also needs chemo. Is there a reason behind this?
Yeah, so Laura, you know, like what happens is many times the doctors, when they diagnose it as DCIS, and she had a mastectomy on the, so is the DCIS, so with the DCIS, the mastectomy done on the right side, or the DCIS now is on the other side of the breast?
She was just saying that it was she decided it's the right breast. So they removed the right breast, and
Okay.
initially she was going to do like I said, she only had to do radiation, but then she was also told that she has to do chemo. She said her oncologist did mention something about her too, but she didn't get enough information.
Okay, so I think what happened here is, while doing the surgery, right, a lot of times in the imaging technology, we know that this is DCIS, but when we do the surgery, we are actually going inside. And that's when we realize that, you know, if it has invaded more or not. Apart from that, probably there are other factors, because when we are doing the surgery, we are actually taking the tumor and analyzing it. We look into the grade, we look into the receptor status. We also look into the, you know, like if any, I'm sure she must have done some genetic mutation if that needs to be done, if there is some mutations that has caused her cancer. So when we look into the different variables, and if the doctors think that, okay, she is a very high risk, and if they're not comfortable, that they feel that it might have gone little invasive, then probably that's the reason they're thinking of the chemotherapy. It doesn't have to be. I'm pretty sure from DCIS, no one can, because she must have done a full body scan before, which kind of showed that she is not at all, she can't be metastatic, because, or any lymph node which is affected, because I'm pretty sure with this situation, her lymph node is also not affected. So probably through her biopsy, they might have figured out something. So if you would like to email me her reports, I would definitely like to look at it, analyze properly, and then give you a call to explain.
Okay, thank you.
Thank you,
That's
Laura.
great. Okay, Lopa, I think we have covered most of the questions. So over to you now.
Yes, yes. So
can we have a second, please?
yes,
Lopa?
yes.
Yes,
Hi,
yes.
Uma ma'am, you are there. Okay,
Yeah, hi.
great, great.
Hi, Dr. Bhaskar. Nice
Hello,
to
hi.
meet you.
So
Hi.
Uma ma'am,
From Bangalore.
Laura, Sharon, they all are part of our support group, Breast Cancer Hub.
That's brilliant. Welcome. Welcome.
I wish Dr. Bora also could come down to India with you, Lopa.
He lives in
He loves
UK.
it.
Yeah, absolutely. Yeah.
I would
I
love
know
to.
he's
I'm
in
planning
UK. I
to.
know that.
My logistics are slightly difficult because I have to be on the wheelchair most of the time. But yeah, I am planning to actually my second book, along with my co-author, who is also in the audience, Mary Bora. So we are planning to launch our second book sometime in August or September. So I'm hoping to go to India at that time.
Hi, Mary.
Don't
How
worry,
are
we
you?
have a lot of people here. We do disability runs. We have a lot of systems around here also, Dr. Bora, to help you. We just now had a massive run of disabilities also in our TCS run, where it was an international run. So
Right.
please, we are involved in all of them. So we'll extend whatever help is possible. Please, you can rely
That
on
would be
us.
brilliant. We're brilliant. And in fact, I'm doing some work on raising disability awareness as well. So I
Oh,
think
lovely.
I will connect with you through Lopa. So maybe we can do some work there as well.
Please,
Yeah,
because
absolutely,
I
absolutely. Yeah,
work with Dr. Yeah, Lopa knows her very well, Dr. Bhumika Patel. We do
yeah,
the
yeah.
training for visually impaired and disabilities and all that. In fact, we're training 6 for marathon now, 6 VIs, visually
Wonderful.
impaired. Yeah, yeah.
Yeah.
So that means don't worry, we will extend whatever help is possible whenever it is possible. Definitely.
Thank you. Thank you so much. Really
Thank
appreciate
you,
it.
Uma ma'am.
And
So,
thank you.
yeah,
Welcome. And I also wanted to anyway tell Archana, because you know my story, Lopa. The same thing happened to me, right? When I went to Mumbai with the biopsy and after my surgery and all that, then again same thing. Both the doctors did not see eye to eye. There, Dr. Raj Bardve was the leading onco, in Tata Memorial. Yeah, so he was my brother-in-law's classmate at the NIA, so he took me there. And same thing. There, the doctors felt I need chemo. But here, my Dr. Gopinath, my surgeon who had opened me, he had said, no, you don't need chemo. You only need 45 days of radiation. So when they put me that question in Dr. Badwe's chamber, I didn't know what to say. So I just put both of them online, if you recollect. And then they decided among themselves, without me getting involved in that, because it's a purely a medical thing, which as a layperson I had no idea. At least cancer itself was something, as you said, it was such a shock to everybody, me getting cancer. So that was a very good point again. I wanted to just say that same situation I also faced, Archana. So don't worry, it happened. Just leave it to Smith. Why you all
yeah. I
getting
think it
worried?
was
Don't be there.
Laura's question for her friend.
Lara.
Yeah.
Yes, Lara. Lara, hi, Lara. She's saying hi to me. So that's it. And I'm in Nota, as I put in the remarks, thing, Lopa. So when you come this side, we are going this time to Nimhans too. I have to drag you
Okay.
to Nimhans,
Okay. Sure.
because the No Tobacco movement, what we
Okay.
launched here on the World No Tobacco Day, we received 300 creatives from youth against tobacco, which was awesome.
Wow, very good.
So
Very
I
good. Yeah, I
think
know
we
in
need
India
more
now, a
voices.
lot of groups are doing the tobacco campaign, which is so
Yes,
needed. And I'm equally doing it in India, Africa, and US also, because in US, in the youth also is needed, because in some form or the other, maybe not chewing
yes.
tobacco, but smoking and all. Yeah. So
I think
that's wonderful.
one of the other important thing is not just with the tobacco, but to look at the mental health bit
Yeah.
with
Yeah.
cancer. That's there is a big gap there,
Yeah.
both pre-diagnosis and post-diagnosis. Because I know from my own experience that there is a big gap in the
Yeah,
mental health bit.
Yeah, and that's where I think Dr. Bhaskar, I wanted to invite you. And before that, I also wanted to say that we have in our BCH family, we have experts in the crisis mental health. If anyone needs any support, and we just had a webinar, but the webinar that I showed you over there, we had our expert in there. So please, anyone needing any help, like, sorry, I just shared the wrong one.
Dr. Sandhya Ravi is here, right?
No, I don't. Yeah, so I'll just take you there. Before I would, so here, so Dr. Bhaskar, so this is basically, we had a webinar this time, and we also have experts on our forum. So if anyone would like to, needs any help, with the mental health situation going through cancer, please let us know. We will always be there. And also we are working with the LGBTQ plus community. So we are trying to work with the screening and all of that. And so if you know any LGBTQ plus community who needs support and strength, because only thing they need is acceptance. And that's where I'm trying to work a lot with them now. So anyone needing help is of course always there. So that is something I wanted to convey the message. And I would like to now invite Dr. Bhaskar to please speak about your journey a little bit, so that because he's an inspiration for all of us. So please, Dr. Bhaskar, if you would like to share your story.
Thank
Very
you.
much for that time.
Thank
Thank
you.
you, Lopa. Thank you, Dr.
So
Bhaskar.
as Lopa had introduced me, that I qualified as a doctor in 1999, and then I immigrated to the UK. I was actually working at Tea Garden as a medical officer before coming to UK, so I know exactly the mentality of what happens in a tea garden in terms of the awareness. Uh, but I had been working till 2019 when unfortunately I had to go for a an operation for a trapped nerve, and the operation went wrong, and I ended up coming out of the operation with paralysis of both legs and a non-working right hand. So because of a severe spinal cord injury, so it's now almost 3 years. So I'm more or less confined to a wheelchair, although I can take a few steps with crutches. But while this was going on, and they were having regular scans on my spinal cord, I was detected to have cancer of the thyroid as well. So I had to have plenty of operations on my neck, around about in within about 3 to 4 months in 2019. And just yesterday, I went to see the doctors again. I've been advised another surgery. So from being a full-time doctor, I became a full-time patient, but I have tried to keep myself as positive as possible, thinking that there might be some other reason for my being. And I have recently published a book called The Second Chance in Life, which is available on Amazon and in India in Flipkart. So this is about my journey about through the cancer, through the spinal cord injury, living with disabilities, and living with a positive outlook and trying to heal not just myself but with a few others. So and I do a lot of talk in terms of motivating others. So yeah, so please do check out my book if you can. You can see it on my background. It's called The Second Chance in Life. And yeah, that's more or less about myself. So if I can be of any help to anyone, I take that as a blessing now in terms of working as a cancer advocate and as a disability campaigner.
That's amazing,
Thank
Dr.
you, Mr.
Bhaskar. And for our audience,
Thank
we
you.
have published Dr. Bhaskar's journey, life. Let me just pull that so that I can share it so that if anyone would like to read through. So,
Yes.
and as I always welcome our advocates to share their journey. So we have Dr. Bhaskar's also. I'm sharing it in the group so that if anyone would be interested, please look through. It has all the details
Thank
and
you.
also the information about the book, and if you would like to read through. And I know we have Laura also, who is an author with her book. So
That's
and
wonderful to know.
it's a blessing to have so many like amazing people in our forum. And thank you, Mary, and thank you, Sharon, and thank you, Uma ma'am, and Shanta has joined in. Thank you so much. Yeah, so it's an amazing journey of Dr. Bhaskar, and thank you so much, Dr. Bhaskar, for keeping the spirit on and not giving up. And I know you're doing so many different activities, and it's not easy, but it's never giving up is the best way to look at life, right? Because every experience is a learning, and we evolve as a different person. That's what I feel.
Yeah.
Of
We
course,
also
of
say
course.
experience means you become experienced. So, these experiences make you experienced, and I think makes you more mellow and more humane.
No,
And, this,
absolutely. I totally agree with you. I mean, I've had the privilege of doing the journey twice, as I said, as a doctor
yes,
and then as a patient
twice
as well.
blessed,
So,
twice blessed.
so
Yeah,
it is everybody fights for themselves. That's a part of the struggle, but only the very few privileged ones get to fight for others. And that's what Lopa is doing. That's what I am trying to do, because that's a
yeah,
blessing. And
yes,
one thing I always say that it is what the life throws at us, we cannot control. But how we
yes,
react to those curveballs define who we are. That's what I'm trying to do. It's hard. I can't be positive all the time. I do moan quite a bit in front of my wife, and also kind of Mary knows a bit as well because we've been working together on our next book. So, but yeah, generally I'm trying to be positive because positivity plays a big part, both hormonally, biochemically, as well as the impact it has on any forms of medical problems, including cancer. Because if you give up, it's very easy to give up. If you give up,
Yes,
then
I know.
chances of getting better is very less.
That is why we always say we all are fighters. We
Absolutely,
always
yes.
fight. We have to be fighters. And I've shared your story with, we have an awesome person working with us for many years now. He lost one leg because of a truck came and hit him. He was a bouncer in pub world, where myself and my children used to go there occasionally for a beer or something. So we befriended him, and unfortunate Greg lost a leg almost. It crushed him. He was very tall, as a bouncer, you know how he is. Yeah,
Yeah.
sometimes he is getting into depression. We have taken him on in our office. So he is very positive now, seeing me, but still sometimes he goes into that what you call the depression, because amputation is almost now reached up to his thighs. Now I made it possible for him to go through different limbs and all that. But now he removes when he comes and sits in the office chair. So he puts it on again, at least with the crutches and all. And we bought him a special vehicle, a three-wheel vehicle,
I'll
which
be very happy to
we took.
speak to him if you think I can be of any help.
Yeah, for my Greg. Yeah, he needs, and
Okay.
his mother is in the ICU from past 10 days. So he's rather depressed. He's rather depressed.
I'm
But it's
sorry to hear that.
don't
Uh,
mind, we don't mind. I will really love Greg to have a word with you
yes,
because
sure.
you are sharing sort of the same journey,
We
and
are.
being a bouncer in a pub, for so many years. Just imagine. I mean, he's a breadwinner, and yeah. So thank you.
Now, thank you very much. Actually, that's another
I
point that
hope
we'll
to
have
meet
to
you
cover
soon
in
in
hopefully
India.
in one of our future seminars, which is the financial
Yes,
impact of a disease, especially financial impact of cancer. I think
very,
that's one
very.
big subject that we have
Yes.
to cover. So I think
And I'm
Lopa, we
still
have
fighting,
covered
doctor.
most of
I'm
the
still
things.
fighting. I'm still fighting for our insurance. I'm not giving up. I'm
No,
still
you should not
fighting
give
because
up.
I lost.
So,
No, I lost. I lost the insurance. They supported me after my surgery 25 years ago. Next year, when I applied, they said pre-existing, and after that, I've not been able to get any insurance. That is 22
uh,
years.
I hope
But
I hope it gets sorted soon.
hope so.
So
I hope so. Not so much for myself, for others. Thank
thank
you.
you.
Good talking
Thank
to you,
you.
Doctor. Good
Thank
night,
So
Dr. Lopa.
thank you. Good
thank
night.
you very much. So Lopa, I think we have covered most of the
Yeah.
things, and I hope we can have another webinar in a couple of months or whenever you are available, because I know you are very busy with lots of commitments.
Yeah, no, no, absolutely. So I already
Coming to
have
India.
things planned out with the
Yeah.
webinars and all in August, and I'm coming back. And then in September, October, we have, because it's a breast cancer awareness month. So I have strategized all of that. So bringing different ways, how we can, based on the need of the requirement of our survivors, our patients, our community, and that's how the webinars are molded. So yeah, definitely, Dr. Bhaskar. So I don't know if anyone has any more questions, would you like to unmute and ask? Because I think we would like to wrap up now, right, Dr. Bhaskar?
Yeah.
It was such a pleasure. Thank you.
I
Thank
think
you
it's a
very
pleasure.
much.
It's a pleasure always to have Uma ma'am and everyone in the forum. Yes, Laura, you have a question?
No, no, I was just gonna say goodbye when you guys said
Okay,
goodbye.
yeah.
Thank
Yeah.
you, Laura.
No,
Thank you,
thank
Laura.
you. So probably
Bye,
in a
Laura.
formal way, I can then wrap up the session, Dr. Bhaskar, with
Yes,
your
please. Yeah.
permission. Yeah. So thank you so much, everyone, for joining in today. And thank you, Dr. Bhaskar. Honestly, this webinar, because you wanted to do it in your network. So because I have been doing this all the time with our network, and I'm so glad you brought it up. And now this will reach to your own network of family and friends. And because this is so important, each one of us has to step up. And thank you so much, Laura, Mary, Sharon, Shanta, and Uma ma'am for joining in today. And I know others were also there. Anjana was there. So who could take time, and Cherry also. So thank you, everyone. So hope to see you all again in our next webinar. And thank you, Mary Bora. So very nice to, catch up like this. So it's, and thank you so much for joining in. And of course, please go through the educational cards, through the breast self exam cards in 24 languages, educational screening cards for other types of cancers. And of course, please go through Dr. Bhaskar Bora's journey, because he's an inspiration and it's a blessing to know him. Thank you so much, everyone. Thank you.
Thank
Bye.
you.
Bye
As we
bye.
say in India, namaste. Thank you.
Bye bye.
Bye bye.